And the frustration, I practiced for 17 years and I've been doing this advocacy work full time for about 10 years. And I've been speaking, I go around and do presentations at hospitals. I've done it at York Hospital here before, about Medicare for All. And over that time period, I've been witnessing how physicians react to what I'm saying. And what I'm seeing now is a level of desperation by physicians that I have never seen before. We know that primary care providers are burning out in 10 to 15 years because of the way the system is, because you're fighting to get paid, you're fighting to get care for your patients. You can't, with Kevin's, father who's having his health problem, and I talked to his doctor about, what was going on. I had to say to the doctor, because he's like, but the insurance. I'm like, but you're the doctor. You're the one who's supposed to be in charge.
They're so disempowered.
And he's just
disempowered.
But the insurance, and I've talked to heads of departments who have said at hospitals that insurance companies basically said, we're not going to pay you. They offered them a deal. The hospital said that's not enough.
That's not a fair deal.
The insurance company said, fine, then we're not going to pay you anything. And then that
Mafia
went on
tactic.
for months. And then finally the hospital had to come back and say,
the hospital was going into debt, hundreds of thousands of dollars.
What
for their
will you
emergency
give us?
room.
Yeah. And that's the same way they were treating
And so the hospital got on its knees and took whatever the insurance company would give them.
But
that is mafia tactics.
Yeah, that is.
But that's exactly how they treated us in private practice. They basically would say, here's your contract, here's what we'll pay you. You had no say, and it was a take it or leave it deal. And so, this is not how our health system has to be. We have the power to actually make it different, and it's hurting us in so many ways to have a health system of this type. So.
The mafia should not be determining our human rights.
Right.
No.
That's another.
And that's what we have.
Yeah.
We have a health insurance mafia. We have the pharmaceutical mafia. Look what the prices they charge.
Yeah.
You can
not
tell.
Related to.
You could tell some of the prices compared to when you practice to now. It's just it's obscene.
Yeah.
And then then you have the Wall Street investors. Every year there's a conference in Washington D.C. Wall Street comes to Washington healthcare, so Wall Street can figure out how they can profit from people's illness.
Right. Right.
And at the conference, Margaret interrupted one of them which was a great event.
2011. Yeah.
When she actually walked into that conference and sat and listened to them, and then at a certain point she got so disgusted she got up and said, "I can't believe you're saying this."
Well, I registered, and I was going to ask a question during the question and answer period. It was literally Goldman Sachs, Citigroup, Wells Fargo, J.P. Morgan Chase. They were the ones sitting at the table and the panel, and they were talking about how they could profit off of healthcare. And at one point, one of them said, well, if we go too far, we risk public shaming.
We risk public shaming if we go too far.
That's what he said. And I turned to the person I had a couple people, support people in there with me. One was a videographer, and I just turned to him and I said, I can't sit here any longer, because I was sitting there and I was taking notes on what they were saying, and they were twisting everything around, in their. And so I just grabbed the microphone and I stood up and I said, well, you should be ashamed of yourself right now.
Yeah, they should.
Yeah.
Definitely.
Even discussing.
Yeah.
Doing things that would risk
But
public shaming when people are suffering.
Right.
Yeah.
It's just incredible.
Yeah, that's what we're up against.
Now, one of the interesting things about the Affordable Care Act is that it also recognized the need for prevention. And it gives people access to prevention.
To preventative testing.
Preventative testing.
Tests.
Yeah,
Right.
that's what I'm talking about, screening tests,
Right.
like she was describing.
Right.
But what it doesn't provide is access to the care once you find out you have the illness.
Yeah.
So that's what the doctors.
The bizarre backwards nature.
They're saying now we can diagnose patients, but they can't necessarily get the treatments. And this was a way that the insurance companies gamed the system. So they were required to cover all people regardless of pre-existing conditions, which is a good thing. But we know that the private insurance companies, their bottom line is making profits for their investors. So they always find a back door to work around that. They created these ultra-narrow networks that actually leave out major medical centers. So the ultra-narrow networks leave out 70% of the health facilities in your area. So then
you have cancer, and the cancer
center is not
included in your
network. So then you're out of network. You have to pay out of pocket for that, and that doesn't even qualify for your deductible, your high, your multi-$1,000 deductible that people have.
You pay your pocket and have a high deductible, and after you pay, you still have a high deductible.
Right, right. So it's
and you're still sick.
And you're still
sick.
Yeah. And this is why we continue to see high rates of people that can't afford the care that they need, that are going without. And exactly the same situation that you talked about is happening, where literally people have to decide between, am I going to get cancer treatment, or am I going to keep my house? Am I going to be able to, send my children to college? These are decisions that people in the United States, the wealthiest country in the world, are facing, and this is ridiculous.
Or an insurance company that's telling a doctor, you only have 20 minutes for a visit.
Oh,
Right.
jeez.
Yeah.
I hate that.
Yeah, I remember I used to write prescriptions, and I would send the patient out, and they'd go to get their prescription filled, and then the pharmacy would call me and say, well, you need to call the insurance company and get authorization. I'm like, isn't a prescription author? Like, here, I've said the patient needs it.
Right.
Why do we have to do another step here? But you did, I have to call up the insurance company. And
It's part of the unnecessary bureaucracy.
Fight with
The
them, yeah.
500. That's the part of the $500 billion in waste. Every one of those times that you have to do that, that's waste.
and it takes away
Constant.
from patient care.
And makes it.
patient
That's right.
time.
Yeah. So, and one of the absurdities of many in this system.